بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائي طلاب وطالبات المستوى الرابع، برنامج بكالوريوس طب وجراحة الفم والأسنان. أهلا وسهلا ومرحبا بكم في لقائنا السادس من لقاءاتنا التعليمية ضمن مقرر طب الفم. في هذا اللقاء أيضا سنواصل الحديث عن investigations and also we'll talk about the biopsy. In the last lectures we had talking about the investigations regarding blood tests, and also we had talking about the investigations regarding the radiography and imaging. In this lecture we will end the talking about the investigations. We will talk about the biopsy. The references of this lecture will the oral and maxillofacial medicine, the basis, diagnosis and treatment for Crispy and Scully, and also the oral medicine and pathology at a glance for the same author. At the end of this lecture we will talk about the biopsy. The student at the end of this explanation and lecture should be able to define and understand all types of biopsy and its indications. We'll talk about the different types of biopsy, and also the students should be able to perform diagnosis, perform the biopsy as a surgical procedure with the correct procedures and techniques, and the students should be able to differentiate between the incisional and excisional types of biopsy, as well as the students should be able to mention what is the vital stains and their indications and advantages in the clinical sessions, and what is its important in reaching the final diagnosis.
So we will talk about the definition of biopsy, indications of biopsy, uses of biopsy, the procedure how you will perform an incisional and excisional biopsy, and we will talk about the vital stain such as the toluidine blue stain. Definition of biopsy: the biopsy is the removal of small piece of tissue from living body for the purpose of diagnosis by microscopic examination. So after taking the patient history, you will perform a clinical examination, as we mentioned. After you perform the clinical examination, you may reach the differential diagnosis. So how you will differentiate the clinical findings, the similarities in the clinical findings? You may ask for investigations. Investigations might be a blood tests, as we mentioned in the fourth lectures, or might be a radiographs, or you may need to perform biopsy to reach the final definite diagnosis for the clinical lesion. So as we mentioned, to confirm or make a precise definite diagnosis. What are the indications for biopsy? The indications of biopsy includes the following. Number one, neoplastic or pre-malignant features. If you find by clinical examination any neoplastic changes or pre-malignancies, clinically presented features, persistent lesions that are of uncertain etiology. So you find a lesion persistent without any associated etiology and failing to respond to the treatment. Confirmation of the clinical diagnosis: you perform a clinical intraoral and extraoral diagnosis. So you can not reach the final diagnosis. You will be reach the final diagnosis by biopsy. Lesions that causing the patient extreme concern. If the patient had a great concern for the persistent lesion, you may need to perform a biopsy to confirm if there is any problem for the patient. Examples for each indications: as we mentioned, if there is any lesion which have a neoplastic or pre-malignant features such as erythroplakia, leukoplakia, lichen planus, focal pigmented lesions, and also any lumps. Also, if there is any persistent lesions of uncertain etiology in the soft or in the hard tissues, if there is any persistent lesions failing to respond to treatment such as ulcers, if you treat the oral ulcers and it persists for 2 weeks or more, so you need to perform a biopsy. And also any other radiolucents or radio-opaque bone lesions, persistent focal lesions involving the gingiva or the periodontium, like lumps, ulcers, and non-healing extraction sockets. Also, you need to perform a biopsy for confirmation of the clinical diagnosis, such as the Sjogren syndrome. Clinically, you may find a dry mouth and dry eyes, and the patient cannot swallow due to lower volume of the salivary secretion. You can confirm the diagnosis of Sjogren syndrome as an autoimmune disease by performing a biopsy for the minor salivary glands of the lower lip. Finally, the indication of the biopsy is the lesions causing patient extreme concern, such as when patient may prefer a biopsy for excisional or incisional biopsy if there is any persistent red or white or pigmented lesion or lump. The uses of biopsy. So, we use the biopsy to diagnosis or in reaching the final diagnosis. Also, we can use the biopsy for grading the tumor. If the tumor is well differentiated or ill differentiated type of tumors, metastatic lesions can be also reached or diagnosed by biopsy. Recurrence, we may need to perform a biopsy for evaluation or assessment if there is a recurrence of previously removed lesion. Management assessment, also we may need to perform a biopsy to assess the management which had been done. Multiple biopsies indicated where we need to do a multiple biopsies if there is additional investigations such as immunostaining are required. So the first biopsy will undergo a conventional histological assessment, and the other biopsy will undergo an immunostaining assessment. If there is malignant disease which is suspected, widespread leukoplakic or erythroplakic lesions, we can call it geographic biopsies. Biopsy procedure, how you will perform a biopsy. Informed consent firstly should be taken from your patient for all operative procedures. So there is an agreement from your patient from you to perform the procedure. So it is a surgical procedure. You should take an informed consent from your patient. Complete the request form, which will contain the patient full name and date of birth, hospital number if applicable, also clinical features, and the site of the biopsy should be written clearly in the form, and the date and the site of biopsy, as well as you should write the clinical history of patient and also dates, numbers of all previous biopsies. The container must be labeled clearly with the container of the biopsy. So after you will take the biopsy, you will put it inside a container, specialized container for biopsies. So it must be labeled with patient full name and date birth, and the number and the date of the biopsy, and also the specimen site, from which site intraorally you had take this piece of tissue. Scalpel or laser cutting, excisional biopsy, or there is an incisional biopsy, we can use the scalpel or the punch. So the excisional biopsy, you will take the whole tissue, the whole lesion, but in the incisional biopsy you will take a small piece of the lesion. This is the shape of the scalpel, and this is the punch biopsy. There is also an intraosseous biopsy, in which we will take a piece or some tissue from bone. Punch biopsy, as we mentioned, frozen section biopsy, so the tissue which will be biopsied will be before frozen. Exfoliative cytology, from the cells overlying the tumor or the lesion, we will take a sample. Fine needle aspiration, we will take a secretion or any other type of the tissue from the lesion by fine needle, or there is a fine needle cytology. Also there is the oral CDX, which can be also the test for diagnosing the presence or the absence of cancer. Fine needle cutting biopsy also can be used. In the excisional biopsy, small lesion or smaller lesion than 1 centimeter is the indication of excisional biopsy. Sessile or pedunculated lesions, sessile lesions and pedunculated lesions. The sessile lesion has a wide base, and the pedunculated lesions has a neck at the base of the lesion. Movable tissues located above the mucosa or just beneath the surface is also the indication for excisional biopsy. As we see in this clinical pictures, this patient complaining from an exophytic lesion, and it had been done for excisional biopsy. The clinical procedures of biopsy, starting with local anesthesia, so you have to anesthetize the surgical site, but the anesthesia not directly into the lesion, so it will disrupt the composition of the cellular tissue of the specimen, and the histological reading will be difficult. So we can perform what we called it a field anesthesia. So we have to anesthetize the surrounding tissues around the lesion. Elliptical incision should be performed. The blade should be at angle of 45 toward the center of the lesion. This is the shape of the punch biopsy. Pulling the tissue by suture. You had to take the tissue by suture or by the help of tissue forceps. This is the tissue forceps. Attach it to the edge of the specimen, not to crush the specimen, so the architecture of the specimen should be intact to help the histopathologist to accurately read the component of your biopsy tissue. Dissection of the tissue, gently dissected out with either the scalpel or by pair of surgical scissors. Dissection, this is the procedure of dissection. To make a space to the suturing, keeping the specimen in formalin solution in the specified container. So the tissue must be immediately submerged in 10% formalin solution, and then you need to perform a suturing for the surgical site. Incisional biopsy means that you will remove a wedge-shaped specimen of the pathological tissue along with the surrounding normal zone. So you will take the pathological condition or piece of the tissue with surrounding normal tissue indicated when there is a large lesion, so you cannot do an excisional biopsy. So if there is a large and diffused extended deeply into the surrounding tissue lesion, you will perform an incisional biopsy, indicated also to determine the nature of treatment. Then the procedure of incisional biopsy: selection of the site should be away from the obvious ulceration or area of necrosis in that lesion. If there is any area of intense inflammation which make interpretation difficult, so you need to be away from it during taking the biopsy. The second step, the local anesthesia, and then the elliptical incision must be deep enough to include underlying connective tissue to the level of the muscle or the bone. So the histopathologist should have a piece of tissue containing superficial epithelial layer, basement membrane, and the connective tissue to evaluate the normal and the abnormal architecture and the stage of dysplastic changes if there is. Then the suturing as this last step of incisional biopsy. Intraosseous biopsy in the form of exploratory curettage. This is the tool to take a biopsy from intraosseous areas to determine the nature of large radiological alterations. If you find by radiograph a large radio-opaque or radiolucent lesions, you need to take a biopsy. We called it an intraosseous biopsy. Procedure: selection of the site after correlating the radiograph depending on the radiograph. You will mention the site. Local anesthesia should be performed, and drilling by bear using a small bone bear, specialized instrument for taking a biopsy from bone, in low speed drill, so to avoid the heat on the bone which may lead to bone necrosis after taking the biopsy. Make a small square window through the cortical plate, and then using water spray as a coolant. It is very important to use the water spray as a coolant when you drill in the bone. After removal of the cortical plate, remove the cortical plate of the bone with curette to obtain a deep sample of the underlying lesion, and place the sample in the formalin as we mentioned. Closing the flap, the surgical site should be closed by the incised flap. Interpretation of the specimen. The specimen is reviewed by a pathologist. So after we take the biopsy, we will send it for the histopathologist for the final interpretation. The diagnosis: negative results, no epithelial abnormality. Positive results means definite cellular evidence of epithelial dysplasia, and also the histopathologist will provide you with the grade of this dysplasia. It is a mild dysplasia, moderate dysplasia, or severe dysplasia, or even carcinoma in situ. The patient should be referred for scalpel biopsy if there is dysplastic changes. Atypical results: abnormal epithelial changes, this should be referred for also scalpel biopsy. Total blood test or supravital staining, non-specific stain for cancer and precancerous cells type of stain. We will perform it intraorally to assess if there is a precancerous changes of the or pre-malignant changes of the accused tissue. Acidophilic stain, metachromatic nuclear dye, selectively stain the DNA and also the RNA. Useful for differentiated small dysplastic erythroplakia that require biopsy from small erythematous lesions caused by infection or by inflammation or by trauma. It also helps us in identification of the lesions of high risks patients. Toluidine blood staining, benign ulcerations have well-defined uptake of dye at the margins, whereas the diffuse marginal pattern is characteristic of dysplastic or malignant lesion. So the vital stain toluidine blood stain very beneficial in determining the malignancy or the malignant transformation of the ulcerative lesions. Procedures: first step, you have to rinse the mouth twice with water for 20 seconds each. The mucosal surface is wiped with 1% of acetic acid solution, which can be provided with the vial of the toluidine blood test, followed by application of 1% to 2% of the stain. Rinse again with acetic acid to remove the excess toluidine blue, and then you should rinse with water. The test is highly sensitive and specific for dysplastic mucosal epithelium, so this epithelium contain hyperchromatism, so the DNA or the nucleus will retain the toluidine blue test. Or toluidine blue stain, so it will help you in the localization of the tissue that should be removed. If the mucosa is stained, repeat the procedures after 1 to 2 weeks. If also the positive staining occurs, the biopsy is in order. The use of toluidine blue test and logulus iodine in combination to produce better than assessing high risk patients, and also if there is any suspicious oral lesions. You can use both of the two stains. In conclusion, we had defined the biopsy and determined lists the indications of biopsy, and also we had mentioned the uses of biopsy and explains the procedures of each type of biopsies. And then we had talking about the stains that can use to determine the tissues which must be biopsied. The assignment of these lectures: each student must prepare a mini report about laboratory procedures of histopathological tests. What are the laboratory procedures of the histopathological tests? And this assignment also will provided in the assignment section of this course as an attachment Word document titled Assignment 6 for the lecture 6. Thank you very much, dear students.